Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Numbness, blurred vision, debilitating fatigue. A diagnosis like multiple sclerosis can feel overwhelming, but it doesn't have to define your life. Today, we have Dr. Luis Compres. He's the director of the Multiple Sclerosis Program at Baptist Health Miami Neuroscience Institute, and he's here to share his knowledge with us about MS, as well as answer your questions on this episode of Ask the Doc, No Appointment Needed. Hi, I'm Miranda Gahn, and welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. All right, let's kick things off with a question from Aiden, who reached out to us through our website, allhealthtv.com. Aiden's question is, Dr. Compres, we just found out that my sister-in-law has multiple sclerosis. I've heard it mentioned a lot recently, but what is it exactly, and how does it affect the body? Dr. Compres, this is the perfect question to kick off the show.
I agree. That is a great place to start. So let's say multiple sclerosis or MS, it is a condition where the immune system mistakenly attacks part of the central nervous system, which is the brain and the spinal cord and the optic nerve. And when that happens, the signal that goes through the body is affected or is disrupted. And the symptoms can vary a lot from patient to patient. Sometimes it can be numbness, weakness, fatigue, or balance problems. So there is no single symptom that is specific for MS.
And I know we're going to go more into that, but heads up, Doc, we've got a YouTube question. This one comes from Jalissa, who asks, hey, Doc, why is MS difficult to diagnose sometimes? And what makes early diagnosis so important? And I'm asking because my best friend is being tested for it, and I want to learn as much as I can about it. Good for you, Jalissa. So Dr. Compres, another great question. Why is MS difficult to diagnose? And what are some of the key signs and symptoms doctors like yourself look for? You mentioned a few when it comes to making a diagnosis.
Yes, Jalissa, that is a very important question. MS is difficult to diagnose because we don't have a single test that we can just order and get a diagnosis and answer a yes or no question. It varies a lot. The symptoms can overlap with other conditions, and we have to look at different tests. We have to look at MRI. The MRI, they have specific spots that we see in MS patients, and we put everything together like a puzzle. We listen to what the patient says, the exam and the MRI. Sometimes we even need a lumbar puncture. So it can be difficult to identify, and but it is important to do it as early as possible, because the sooner we diagnose, the sooner we can start treatment, and that helps long-term to protect brain function.
Let's talk about some of those signs and symptoms. We have a graphic, if we could show that.
Yeah, of course. Some of the symptoms can be invisible, and some of them are more obvious. But just to mention a few, fatigue and chronic tiredness is one of the most common symptoms in MS. Numbness or tingling or burning in the arms or the face or even the body, that can also affect MS patients. Muscle weakness or spasms in the legs or in the arms. Vision loss, which is one of the most common symptoms, usually in one eye, or painful eye movements, and balance and coordination problems.
Thank you so much, Doctor. So this next question comes from Devin via our Facebook page. He posted, "Hi, Dr. Compres. Is MS hereditary? I'm asking because my cousin has it and my fiance's brother was recently diagnosed with it. Dr. Compres, Devin asked a really important question. Is MS hereditary?
Well, Devin, MS is not considered a directly inherited disease, meaning there is some genetic component, but the vast majority of patients, they don't have a family member with MS. Um, there is increased risk in certain families, and yes, patients or people with a family history of MS, they may have a higher chance, but we are talking about small numbers.
All right, this question is from our Facebook page. It's from Winnie, who asks, Hey, doctor, what advice would you give to someone who has just been diagnosed with MS and may be feeling overwhelmed or frightened? Dr. Compres, Winnie has a really good question, and I'm sure just like anything, one's mindset can play a key role when it comes to any diagnosis.
I completely agree. And this is very common and normal. One of the first things I say to the patients is take a deep breath. This is overwhelming. There are a lot of changes going on in your body. And there are so many questions that you have. Um, but MS today is not what it was a few decades ago. We have many more treatment than we didn't have 20 years ago. We can do better monitoring for these patients and tailor a personalized program to each individual need. We are learning more and more about MS, and the more we learn, the better we take care of these patients.
Yeah, I think that's so true, Dr. Compress, because I think a lot of people, when they hear that, in the past, it was almost like you're going to have a shortened life, you're going to end up in a wheelchair, but that's not the case. You've made great advances.
That is correct. And that's one of the first questions sometimes patients ask. Am I going to die from this? Am I going to end up in a wheelchair or bedbound? And that is a great opportunity for me to explain what is the natural progression of MS and what are the most recent advances.
Well, up next is another question from our allhealthtv.com page. And this time it's from Jenny, who asks, Doctor, my niece has been diagnosed with MS, and I know it's a neurological condition. And I'm concerned about what that means for her long term. Is MS life-threatening like other serious neurological conditions? We're just talking about this. Hi, Jenny. Thanks so much for reaching out to us. And we're sorry to hear about your niece. But, Doctor, I'm sure you have some great advice for her on what to expect.
Yes, Jenny, indeed, MS is a serious condition. It's a chronic and serious condition. However, we do not look at it as life-threatening. The mortality rate or patients with MS, they live a very similar age than the general population. The bigger concern with MS is usually how it's affecting your function, how it's affecting your quality of life. What can we do to have you live your life as normal as possible? And that also plays a role of getting the right diagnosis and treating it as early as possible. So yes, it is serious, but there is a lot of hope.
There is. And we've got another YouTube question. Thank you, doctor. This time it's from Colton. Colton asks, Hi, Dr. Compress. Can MS be cured? If not, what are some of the treatments that can help a person get this condition under control? And thanks so much for reaching out, Colton.
All right. Colton, we don't have a cure for MS, but we do have treatments that can make a very meaningful difference in every patient's life. We have disease-modifying therapies that can reduce relapses, reduce new symptoms, reduce new inflammatory activity. But not only that, by treating these patients, we can slow the long-term progression that occurs in some of these patients. But way beyond the treatments and therapies that we have for MS, we are also learning how to manage with symptoms better, the importance of rehabilitation, and coming up with different ways to improve the quality of life. So there is no cure yet. But we can say MS is treatable, is a treatable condition, and that we are doing a better job now than we used to do before. And the future for MS is bright, and I'm very excited about it.
Yeah, I bet. You talked about a lot of the advances that you've made. And again, in the past, people thought, this meant, it's going to shorten your life, almost like a death sentence, that you were going to end up in the wheelchair. But a lot of changes have happened. If you could just real quickly, over the last, let's just say decade or 20 years, how many advances have you made? And when you talk about treatment, can you give us some specific examples?
Yeah, that's a great question. And we can definitely talk about it for 2 hours because there's
We ain't got that much time, Don, but it sounds good. Maybe another show.
So let's talk a little bit about how we are diagnosing MS. Now we can diagnose MS sooner, even in patients without symptoms, just by looking at specific markers on MRIs, and that is something that all of the MS doctors we are getting excited about, because as I mentioned earlier, the sooner we treat a patient, the better they do. But what can we do to start treatment sooner? Well, we should diagnose it sooner. And now we came up with new diagnostic criteria that can help us with that. That's just one point. Now, in terms of MRIs, we can see footprints of MS lesions. It's just not what it used to be of counting the number of spots that patients have on MRIs, but we can look at those spots on MRI, those lesions, and we can tell if they are specific for MS or not. And that helps us to try to come up with a right diagnosis for MS. The consequence of that is one, to diagnose sooner, and two, to decrease the rate of misdiagnosis. You'll be surprised, but approximately 1 in every 5 or 6 patients, they are diagnosed with MS, but they do not have MS. And really, these advances can help us bring that number down.
Wow. Why is that, though? I have to follow up with that.
Yes. Well, one of the biggest things is that we don't have a single test to diagnose MS. It's not looking at the blood pressure, and if the blood pressure is high, well, you have high blood pressure. MS is putting the puzzle together. There are many different things that we use, and MRIs is one of those. And there are a lot of things that can look like MS, but it's not MS.
Wow. Okay. Well, good to know that. Doctor, I want to go to another question. This one from the tube. It's from Lacey, who asked, Dr. Compres, my mom has MS, and sometimes it seems like it's under control. And other times she gets what she calls relapses. What is a relapse and what causes it? And I'm confused about this myself, doctor. Can you give us some clarification?
That is one of the subjects that I like to educate patients and other providers a lot, because we all use different terms about what a relapse is, as exacerbation, a flare-up. There are many different names that we use, and I always advocate to try to use just one explanation. But let's go with what a relapse is when a person develops new neurological symptoms lasting more than a day, usually a few days or a few weeks. And that is associated with new MRI activity. So symptoms that they never had before, associated with new MRI lesions, and usually active MRI lesions. Now, that is a relapse. However, and this is the most important distinction, is that MS patients, they tend to have worsening of all symptoms on a temporary basis. What I mean by that is, let's say If they had numbness in the right arm many years ago when they were diagnosed with MS, and that numbness over the past few days is coming back, is being more bothersome, you may think that the MS is getting worse, but it's actually not. The symptoms are getting worse. And why is that happening? Well, stress can do it. Lack of sleep can do it. If they are having any sort of infection, that can do it. And as soon as you control that, the symptoms can get better, and it should go back to their normal, how they were before this worsening. And what is the implication of that is that, like I mentioned, doesn't make MS worse. So we don't necessarily need to change therapy.
Okay, this next question is from Carter, who reached out to us at allhealthtv.com. And just as a side note, if you haven't already, we highly encourage you to check out the website when you get a chance. It's just chock full of great and useful information. All right, back to the next question. He writes, "Hi, Dr. Compres. What should patients look for when choosing a physician or sitter for MS care and treatment?" Excellent question, Carter. Dr. Compres, I mean, especially when you just said that 1 in 5 people are misdiagnosed to having MS. That's a really good question. So what do you suggest?
Yes, and that comes to choosing a provider with experience in MS, and a provider that knows what MS looks like, that studies MS and see a lot of MS patients. We get good at distinguishing who are these real MS or what else could it be. So a center with someone with that experience. MS is a very complex disease, and there are, like I mentioned, a lot of advances. So a center that can incorporate all of the new technology can help you monitor and treat your symptoms. And also something important besides the neurologist, because this is a team effort and we are all just part of it, is a center that you can see other specialists if you need it, that can treat your symptoms. For example, if you have bladder or urinary symptoms, you want to have a urologist that can take a look at you and have direct communication with your physician. And at the end, it's someone that you're going to feel comfortable with, that can give you the time to listen to your concerns and answer your questions.
Good information. All right, this next question comes from Aurelia, who reached out to us via Instagram. Aurelia asks, "Hi, Doc. How are treatment centers using new technology, research, or multidisciplinary care to improve outcomes for people living with MS?" Aurelia, what a great question. Doctor, tell us how you treat MS at your center.
Yes, because MS care is now more precise and more team-based. That's what we all need, that this multidisciplinary care and advanced technology, right? So now we have better imaging, closer monitoring, and more individualized treatment options for these patients. So I basically, what I try to do is get the right diagnosis, use the latest advanced technology to diagnose these patients and all the resources that I can, and also establish patient with different providers if they need it for their symptomatic control, and to try to provide the best quality of life. Not only that, also I try to focus on things that maybe we don't talk as much in clinic, but it's a lifestyle. We try to educate patients a lot and help them create a better lifestyle for them that can help MS, and not only help MS, help their symptoms.
Yeah, help the symptoms and look at the person as a whole. Here's another really interesting question, and this one comes from Natalia via Facebook. He asks, "Hey, doctor, does gender play a role in who gets MS?" And it seems, according to this person, like I know more women than men with the disease. I love this question because I've wondered this myself. I mean, we've heard a lot about Christina Applegate, right? All over. It seems like you do hear more about women than men. So is there any truth to that?
100%. Yes, MS is more common in women than in men. Approximately 4 patients, 3 are going to be women with MS. We don't fully understand why, but there's some genetic components. There's some hormonal components to the MS biology. So we have some understanding, but yes, indeed, multiple sclerosis is more common in women. And that also varies when women with MS, they get into the menopause phase with those hormonal changes. It's important to recognize that because symptoms can get worse during that phase.
And what approximately age are we talking about? And I know that you said that you've made a lot of advances and you're hoping to catch it earlier with these MRI brain scans, but typically, what's the age range when someone is diagnosed with MS?
I always say is a young female. Usually, when patients start getting MS is from 20 to 40. That is considered young in multiple sclerosis. So the typical is a female in their 30s. That's when symptoms start to develop.
And, I still, not to hammer this so much, but I know you talked about it earlier that 1 in 5 people are misdiagnosed with MS. Obviously you're an expert where you work, you specialize in this. That happens too much. But what do you notice that the other doctors are missing?
One of the most common how MS patients are misdiagnosed is because MS symptoms are not 100% specific, and there can be overlaps with other conditions. And same thing for MRIs. MS lesions on MRIs, they are very specific in that sense, but there are other conditions that can have lesions on MRI. So it can be easy to have non-specific lesions in the brain from even with age, plus neurological symptoms, and sometimes we think 1 + 1 = MS, but not necessarily. So I see a lot of patients with migraines that they get diagnosed with MS. Sometimes migraine patients, they can have some neurological symptoms. So the list is very long.
Yeah, it sounds like it, but we're glad that we have people that specialize in this like yourself. Doctor, we only have about a minute remaining, but I do real quickly want to go to this next question from Ravi, who reached out to us on Instagram, and he writes, Dr. Compres, what are the common misconceptions about MS that you would like the public to better understand? We discussed some of them, but are there any that we left out, doctor, that you would like to mention?
Yes, I'm going to try to do this rapid fire, okay?
Rapid fire. There you go. I like it.
Yes. One of those is that MS equals to severe disability, which is not. Another one is that pregnancy is contraindicated in MS. It's not. Actually, pregnancy makes MS better. Another one is that people pass away from MS, and no, the mortality rate of MS patients is similar to the general population. And the last one here is that there are invisible symptoms of MS that can impact the patient's life, and they are very important to treat.
Dr. Compres, we learned so much. Thank you for that rapid fire. I'm Miranda Kahn, and we'll see you next time on Ask the Doc. Thank you for all of your questions. Be sure and check out our website.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.